So my name is Shayla and I'm going to be presenting how to prevent HIV. What is HIV? HIV stands for Human Immunodeficiency Virus. It weakens a person's immune system by destroying important cells that fight disease and infection. No effective cure exists for HIV, but with proper medical care, HIV can be controlled. Some groups of people in the United States are more likely to get HIV than others because of many factors, including their sex partners, their risk behaviors, and where they live. Signs of HIV. These signs include a headache, fever, tiredness, swollen lymph nodes, sore throat, thrush, rash, muscle and joint pain. Within a few weeks of HIV infection, flu-like symptoms such as fever, sore throat, and fatigue can occur. Then the disease is usually asymptomatic progresses to AIDS. AIDS symptoms include weight loss, fever, and night sweats, fatigues, and recurrent infections. People may experience pain areas in the abdomen. Pain circumstances can occur while swelling. Cough can be dry, whole body. You feel fatigue, fever, loss of appetite, malaise, night sweats, or sweating. You also feel nausea, persistent diarrhea, vomiting, or watery diarrhea. In the mouth, you feel like you have a white tongue and you feel dry. And with your groin, sores or swelling. In your throat, difficulty swallowing or soreness. Prevention. Today, more tools than ever are available to prevent HIV. You can use strategies such as abstinence, limiting your number of sexual partners, never sharing needles, and using condoms the right way every time you have sex. You may also be able to take advantage of newer HIV prevention medicines such as pre-exposure prophylaxis and post-exposure prophylaxis. Pre-exposure prophylaxis is when people at very high risk for HIV take these medicines daily to lower their chances of getting infected. Like for example, doctors or nurses are more at risk and they usually take these. It can stop HIV from taking hold and spreading throughout your body. It is highly effective for preventing HIV used as prescribed, but it is much less effective when not taken consistently. Daily PrP reduces the risk of getting HIV from sex by more than 90%. Among people who inject drugs, it reduces the risk by more than 70%. Your risk of getting HIV from sex can be even lower if you combine PrP with condoms and other prevention methods. Post-exposure prophylaxis. So it's like the other medicine, but this one is after you have HIV. So this means taking antiretroviral medicines after being potentially exposed to HIV to prevent becoming infected. PEP should be used only in emergency situations and must be started within 72 hours after a recent possible exposure to HIV. Testing. The only way to know for sure whether you have HIV is to get tested. CDC recommends that everyone between the ages of 13 and 64 get tested for HIV at least once as part of your routine in healthcare. And here's some statistics that show that people ranging in the age of 25 through 34 are the most affected with HIV. And some myths about HIV. People think that if a person with HIV swims in water, they'll get HIV too, but that's not how it happens. Or with saliva, sweat, tears, or mouth kissing, that you don't get HIV from that. And from insects or pets or toilets, you do not get HIV from that. And here are some other statistics showing that the most affected people by HIV are women. And that's it. Thank you. And then there's my audience in the back.